Thanks, Doppler. In tonight's ABC 7 Extra, concern in the medical community over a rise in opioid overdoses in El Paso. One doctor believes it's being caused by laced drugs purchased illegally.
We're concerned that people are buying what they think is oxycodone off the street, and then it turns out to be fentanyl, and without intending to, they overdose on it.
Dr. Sarah Watkins is an emergency medicine physician at UMC, but she also serves as the medical director of the West Texas Regional Poison Center. Watkins says they're fielding more calls into the Poison Center concerning life-threatening overdoses. And the callers are saying they've only taken one pill of what they thought was oxycodone. Watkins said the uptick has occurred over the last month, and she knows of at least a couple of deaths at UMC.
My biggest concern is that with COVID-19 causing so much increased anxiety in people's lives, that they will turn to medication or illicit substances as a way to cope with that stress. And unintentionally, they might be ending their lives because of that.
According to the Association of American Medical Colleges, more than 20 million people in the United States have a substance abuse disorder. And the recession caused by the pandemic may lead to 75,000 deaths from drug overdoses, alcohol abuse, and suicide. The AAMC has also found drug overdoses since the start of the pandemic have climbed 18%. And with more people being hospitalized for COVID, there is more demand for opioids, both legally and illegally obtained.
Anytime someone overdoses on an opioid or other medication like this, then we certainly want to get them connected in the community with social resources, whether that's meeting with a social worker or a psychiatrist or therapist. We want to get them those resources that can help them over the long term.
And Liviana is the primary provider of services for those battling substance abuse issues. And Liviana can be reached at 915-782-4000.